So now we'll go ahead and really just clear the area. And patient, look how comfortable that patient is, by the way. I mean, she's laughing and smiling throughout this whole thing, which is pretty good for a procedure, I think you'd say. Now, let's go ahead and get this one in. And this one, again, slowly but surely, this is going to go all the way down to the jowl area, as you'll see where it ends up there, and get it in there. And a lot of times we'll rotate the needle to go ahead and get it in. Slowly but surely, everything is measured and controlled. I can't say that enough. That is really, really important here. And then again, if she feels like she comes up to an obstruction, you take a deep breath, just grab the tissue. You want to know where you're going to end up and where you're going to be. And sometimes there are ligaments, and this is what you're going to learn in AAFE training. There are ligaments that you're going to come and go up against sometimes in the face. These are the retaining ligaments that hold the fat pads into place. You've got to know when to push. You've got to know when to go ahead and stop and make sure you are in the right plane. And that's exactly what we're doing here as I'm teaching her how to go ahead and do this. So again, we're taking our time in this. A 3-vector lift, again, with someone that has got some experience. This may take me a minute or two to get everything into place. Only because I have experience. But as you're learning this and as you do your first few cases, slowly but surely, again, we're feeling where it is, making sure we're in the right plane, always knowing where the tip is. And 100 millimeters is plenty of room, and you've just got to make sure that you're in at least, I'd say, about half of that, if not a little bit more, and then you can go ahead. You don't have to use the entire 100 millimeters. You can use any amount of that you wish here. So again, curtain over the curtain rod. It's not the right hand doing the work, it's the left hand doing most of the work. And now you can see we're all the way down into the jowl area, and we can feel, we can verify, make sure we are in the right plane as you go ahead and do that. If you want to get a little past it, you pick up that tissue, grab that tissue, you're in control, and really pick it up and push it over the cannula. Now you can see exactly where the tip is, and that's exactly where we want to go ahead and do. Exaggerate the lift, and at the same time, remove that cannula, and now you've got these 3 nice threads that are there, going in 3 different vectors. One to the nasolabial fold, one to the marionette line, one to the jowl area. Now what we can do is really prove to you and show you, pulling back on that, you can see the 3 vectors all come back. Patient is perfectly comfortable from the ComfortTox microcannula anesthesia that we provided ahead of time. So you've got to learn this technique. You've got to go ahead and really get trained really, really well. So you can see that it's an amazing thing that we can accomplish for patients here. Just look at this. Beautiful. I mean, just look at her face from the side and you can see exactly what we've accomplished so far. Now we're going to go ahead and really pull on these threads. Going to go ahead and use a very sharp needle, use the back of that needle, push down on the skin, and by doing that, you're going to clip these threads, and then the end of these threads are going to go right into the skin. And watch this pop into the skin. See that little divot where it is right there? Once you smooth a little bit, pop, there we go. It's going to pop right into place there, and the end of those threads have disappeared well into the skin there. And you can keep, as you go over this a few times with your hands, you actually feel these lifting threads and the barbs that are on them really engage on the tissue, and you want to make sure you get as much of them activated as possible here. And now you can see the gorgeous before and after and a very happy patient.